Hello, this is Dr. Lewerenz from Longevity Health Institute. Hope this finds you well. I want to tell you, and hopefully actually this gives you some insight and some different thinking for the day. Something interesting is we're still here, still practicing medicine, still helping people. Telemedicine, so you get to see my ugly mug like this, still, now on video, even if you're a patient on a visit. This is the beauty of telemedicine. So as I sit in my office and I sit across here, this golf course in Rochester Hills, Michigan, and I'm jealous because I look out there and because of some changes that have been lifted, people are out enjoying the weather and golfing and walking all over the place, and actually good for them. I think you got to get out, take some fresh air in. Obviously, socially safety distance from each other. But I think it's good for the heart and the mind and the soul and your immunity, believe it or not, just by getting out and getting fresh air. Just like you got to eat well and take in colorful nutrients from vegetables and fruits and whole foods, etc. So I do think that's important to enjoy yourself and move your body. Helps your immune system. But I wanted to share with you a couple things that we're still doing, still participating in a telemedicine manner, because it really helps and impacts people's lives, and it happened just today. So a couple simple things, but I want you to be aware of, because of this is somewhat of the beauty in a pandemic of what telemedicine can do and bring to you. And this is for all people out there that this is shared with, is that call your doctor, call your provider, call your internist, family doctor, functional coach, naturopath, whoever it is, and embrace with them about what's going on with you. Because some conditions and diseases don't go away, and some of these things need to be looked at into, even in a pandemic, because what happens is that disease doesn't stop, okay? Conditions don't stop. And I think what's ultimately most important is that we build a strong immune system and we work in a preventative wellness model, because then that serves you and all of us well. And actually, if you think about it from this way, just like always, loving yourself allows you to love others. You being healthy and having a higher immune response and having less disease and less body weight and things that are now issues in America, like obesity and high rates of type 2 diabetes and more cardiovascular disease and cancer, these then affect loved ones, and it's a trickle-down effect. So I want you to kind of keep that in mind. But a couple stories today, just real quick and simple. I'm a big proponent of cardiac calcium scoring. Cardiac calcium scoring is a preventative screening test to where, and I have my own protocols, I kind of follow a little bit on this because I look at age and I looked at some risk factors, but basically, in my opinion, all men over the age of 50 in a preventative screening model, probably even 45 depending on risk, but 50 need a cardiac calcium score. Okay, women also need it, because I actually find this very, very, very interesting. You don't have to have any symptom, and I want to share something with you. So what the cardiac calcium score is, it's a non-invasive CT test. They look in your coronary arteries. Are you laying down plaque and calcium? It'll look kind of like on images, kind of a little bit like this. Here's fairly normal to normal. Are you laying down and are you building plaque, and is it interfering in the lumen of your artery? Here's a diagram actually. As you build calcium in plaque, here's calcium down here. Then as you build soft plaque and inflammation, and these are some markers we follow, actually this is what's picked up on a cardiac calcium score. And that's a quick, easy explanation. But basically you get a number, and then we can quantify that, and we actually use a few algorithms that are cardiovascular and the American Heart Association derived that then we can risk stratify you. But basically 0 is perfect, you have no calcium. And that's wonderful. We can look at you a little bit different. We know that time's on our side to be preventative and all that. But let's say that there's a surprise. Had a gentleman that actually came here and this is what I want to explain to you, is how inflammation and digestive inflammation not only impacts your immune system and inflammation in the body, but I think is his biggest risk, because that's all he's had in his life. He's a little bit over 50, and he actually had a very high cardiac calcium score. So we measured some of these cardiac markers, these inflammatory markers, and they were high in him, but he was compliant and got a cardiac screening calcium score that was way above 0, which is perfect. It was actually up in the 600-700 range, and that is a higher risk, especially if it's laid down in a major coronary artery like your left anterior descending, or actually for any of those for the matter, but that's what they call the widowmaker, where people have big events. This person, other than having an occasional reported chest pain, atypical chest pain, not at the time of us talking and screening, but he had a lot of inflammation symptoms in his body, but this was picked up. Now I'll be able to refer him to a cardiologist, get him on an anti-inflammatory diet and lifestyle, use a few supplements that we use preventatively to augment him, reducing calcium in the body and inflammation in the body. But the key thing is we'll be working on his diet and gut health, and lifestyle. And that's going to be his biggest preventative, but we're going to get him to the right specialist and get him screened further to see what this really means. But here's some underlying risk that is based on inflammation. If you have inflammation in your body, you've ever been told that you have a high CRP, that's a sed rate effect or a C-reactive protein effect, an inflammatory effect in the body, that is an underlying sign that for some reason you have inflammation. And if you have inflammation, essentially that's a root of most disease, including cardiac, okay? And we can fix the gut, fixing diet, fixing gut lining, fixing the epithelium of your gut, these epithelial cells and esophageal columnar cells, and regenerating the gut lining is something we are experts in, and we excited to do it every day. But it starts with diet and lifestyle, and then some fixing supplement protocols. Very, very effective. The other thing I want to explain to you too is, because we see this very often, and this is somebody else actually today, is that how the effects of hormones affect not only your immune system, but also inflammation. So we had somebody that actually has been a patient for a while that gave me a history of they basically have had shingles in the past. They had some underlying herpes. They had been treated in the past for shingles and herpes, which are viruses, very similar family. The shingles virus actually along the same family of the chickenpox virus. But long story short, this varicella virus, okay, often lays dormant in your body. And if there's any inflammation or immune change, it can come to a head. It can rise up out of the nerve root and spinal cord and come out and give you a problem. So this individual actually had been on hormone replacement with us, this female, postmenopausally. She'd been doing much, much better, just got a little sloppy, and I think with the whole coronavirus and pandemic stuff going on, got off some of her supplements, got off her hormones, and just didn't know what to do for the last month or two. And not excuse, but just became a little bit less compliant. When she was off her hormones, and probably due to stress too, she was eating bad and caused a lot of inflammation in her diet. And going off the hormones, which also can be very anti-inflammatory, okay, particularly progesterone and testosterone and DHEA, then her immune system changed. And it had been several years, but she had a shingles outbreak. It came to the surface, typical symptoms of the shingles rash, tingling, prickling, itching, and then pain effect, and she was really surprised. Ironically, she had called us, we told her what to do, and we will further evaluate, we did today in some further testing, her immune system, her gut function, and what she should be on preventatively. But her going just back on the hormones will augment her immune system and help out a lot. In fact, a lot of people will have a lot of immune inflammatory changes when they go through menopause or men andropause, or if they're on thyroid and their thyroid is adjusted, or they've not been evaluated for their thyroid appropriately and they've been undertreated thyroid, or they're on hormones and for whatever reason, just complacence or compliance or life or whatever, they go off hormones, and so all of a sudden their hormones become unstable. This can cause immune changes, and then shingles or herpes or chronic viral infections that they have come to a head, come to the surface. So, there's many things we do and can do to help your immune system and help inflammation, and that's what we're experts in and we are passionate about and love to do here at Longevity Health Institute, me and my practitioners and my staff. But I will tell you that 100%, if you're not hormonally balanced and if you have been off your hormones or not appropriately evaluated by a practitioner, or there's been a hormonal adjustment, and then you see a flare in something that's immune related, like a virus, like a chronic virus, like shingles or herpes, that can be your underlying trigger that you need to get back in line and optimize, and that's your hormones. So hopefully this educates you a bit. Share with others, and we are here to help you. We're doing telemedicine visits in this still home quarantine disease, chronic conditions, and medicine can't stop. That's why we're here. We're here to help you, and call us any day. Look us up online. This is a place of wellness and prevention and bringing you optimal quality health and life. So remember that, and that's what we're passionate about. So hopefully this shares something with you that you can think about and ponder and share with others. And be well, eat well. You need to build a better immune system, and quality of life is going to come with that. And I'm going to tell you the future of medicine, and I'm saying this right now in what we're living in April here, almost May of 2020. We need to take better care of ourselves and each other, and that's what's going to fight all disease and all conditions. This is Dr. Lewerenz, Longevity Health Institute. Be well.